Minute break is from the state of Oregon, the Oregon benchmarks, and we're very pleased to welcome here the governor of the state of Oregon, Barbara Roberts and Duncan Wise, who will make the presentations. Governor, I think you are first on.
Thank you very much, Governor, and members of the panel. I'm delighted to be here this morning to speak on behalf of the Oregon benchmarks. As Oregon's governor and chair of our Oregon Progress Board that manages the benchmark program, I can testify with real enthusiasm about the positive and important role the benchmarks play in delivering and measuring better government. I did not initiate the Oregon benchmarks. My predecessor, Neil Goldschmidt, did that. Yet I found that this new and unique strategic planning idea was so valuable that my administration not only adopted it, but implemented it and expanded its application. Now, since Neil Goldschmidt and I are both Democrats, you might ascribe this continuity to party ties, but there's a whole lot more to the benchmark's durability than that. My 1990 Republican opponent endorsed the benchmarks as I did in 1990. In 1991, I appointed him to serve on the Progress Board, where he still serves. And now in 1994, both major candidates for governor in our state have endorsed the benchmarks, guaranteeing continuity in our state. And perhaps more unusual, the benchmarks process has been unanimously adopted by our legislature after surviving 18 separate committees. Two strengths of the benchmarks explain this widespread support. First, the benchmarks measure outcomes, not effort. In government, we tend to usually measure our successes based on efforts, how many dollars are spent or programs initiated, rather than on the results of those programs. Not so with the benchmarks. We measure literacy and school scores, not education spending. We measure crime and recidivism rates, not prison beds. We measure air and water quality, not regulatory efforts. And since there is a widespread citizen agreement on the outcomes that Oregon wants, we have the roadmap to identify policy, budgetary priorities, and organizational needs to achieve and then measure our successes. The second important feature is that the benchmarks measure progress for the entire state, not simply for state government programs. The benchmarks are as relevant to local government, community organizations, nonprofits, and business as they are to state government. And by the very nature of them, they inspire the collaborative initiatives that are necessary for true progress on the complex issues of today. Benchmarks have inspired collaborative efforts as wide-ranging as watershed health, urban mobility, teen pregnancy prevention, early childhood immunization, and internationalizing Oregon's economy. Benchmarks are a way of thinking that has led to real action and real results in our state. Oregon's workers' compensation costs have dropped by 40%. Adult crime and adult prison recidivism are down. Childhood inoculations are up. New AIDS cases have leveled off. Welfare caseloads are down in my state. And benchmarks also shaped Oregon's nationally recognized education, workforce, and children and family reforms by focusing on the outcomes that Oregon wanted. Benchmark priorities are now integrated, very integrated, into our state budgeting process, and they are used to measure agency performance. They are a new way of thinking. So can the benchmarks be replicated? You bet they can. 7 of our 36 counties have voluntarily developed benchmark systems in their counties, with 7 other counties anticipated to follow by the end of this year. Several cities have now come aboard. Now Oregon's largest private foundation are using our benchmarks for grant making, and the Portland United Way is doing the same. We are flooded with requests for information. Our small Progress Board staff could be on the road constantly helping other localities. Working with the National Governors Association, we developed a benchmarks planning handbook. Now 12 states have benchmark systems or are developing them. But we would like to do more to help other states develop benchmark systems. This is a great opportunity for better government and for shared learning. However, let me be clear. Benchmarks process is not easy. It requires transforming how we approach governing. It demands commitment from the top plus broad citizen participation. It scrambles organizational charts as we cross all of the traditional lines. And Oregon makes no claims that ours is a finished product. But we're proud of what we've started, and the Innovations Award would help us build our program and then share our experience nationwide.
Thank you. Mr. Weiss.
I'll take questions.
Yes, Max, and then Antonio.
One of the questions and some of the material that we have indicates that there are two of the objectives, and Governor, you just spoke to it. One is to try to prevent government from doing bad things, and the other is to motivate people to do good things. How can you know how well you're doing at either of those?
I think probably the most significant thing about the Oregon's benchmarks is it in fact measures. So on an annual basis and biannually to the legislature, we submit reports on how we're doing on each of the things we're measuring. So if we're measuring HIV cases, we know whether our programs are working because we watch the caseload go up or down or stay level. The same is true with welfare reform, with inoculations. So each time we put a group of people, and these are very collaborative efforts together to help us meet a benchmark, then we measure. And if we're using money and program and people and resources and we're not receiving appropriate results, obviously the programs are not working. So we really measure both our successes and our failures.
Antonia?
I'm fascinated by the result-oriented approach, but can you tell me a little bit about the change that has taken place with the people in government? 'Cause that's, to me, the most important part.
I'll do part of this, and I suspect Duncan will do the other part to keep me from getting in trouble. There is no question that if we use the term bureaucracy, it's very hard to change what people have done for a very long time. And the Oregon benchmarks, because they were developed by a governor and sort of came from the top, it looked like they came from the top down, but they actually came from the communities up as they built the process and designed them. But within the government structure, we had trouble getting people to recognize them. They were there and they were nice and they belonged to the governor and maybe some important committees outside of government, but they weren't theirs. How we got government involved and employees and agencies was as soon as I attached the benchmark to the budgeting process, we had instantaneous benchmarks experts. Every agency knew the benchmarks. They could do creative thinking about what benchmarks affected their agency. So that, I think, more than anything else, the connection between budgeting priorities and the benchmarks has been very effective. I think Duncan can talk about the legislative process, and that's really important too.
There are a couple things about employee involvement. One of the things, we do involve collaborative teams that cross agency lines to work on benchmarks for workforce development or teen pregnancy or whatever. And what people working on those teams say is it's the most fun they've had in government because they're focusing on a result, they're working together, and they're working towards progress on something people care about.
Ellen?
You mentioned in your application that you were doing a handbook on catalytic leadership to help other people implement it. Can you say a little bit about what you've learned about how to get people going?
Yes, we do. We have a handbook which we are now using, I think, very successfully. The Catalytic Leadership Handbook suggests is that we need a new form of leadership that really focuses on a question and brings communities around a question rather than taking charge and proposing a solution without the kind of involvement. When you have benchmarks, you have a very good tool for communities to use to get focused on, let's say, a teen pregnancy goal or a child abuse goal, and then bring the community together to really think through systematically how to make a difference. And the Catalytic Leadership Handbook is designed to do that.
Harriet?
My concern is when you haven't met a goal, do you have examples? For example, has a program ever really been cut or sunsetted if it isn't going along, or is it, well, we didn't make it so soon and we'll just say, well, we didn't quite make the percentage. Is it really making a difference in how programs are judged and where resources go?
It has made a difference in terms of where resources go. When we put the budget together, and we're cutting our budgets in Oregon, a good economy but a very bad ballot measure that's causing major cuts in our state government. And while we did that, When we cut all of the budgets and everybody took a percentage cut, the only way they could get money added back into one of their budgets if it was related to a benchmark, and then those programs are measured to see if in fact they are delivering results. It is still a new enough process that we haven't gone through state government eliminating programs that are not succeeding yet, but we have eliminated programs out of the state budget that did not direct themselves to Oregon benchmarks. And if they didn't direct themselves to a benchmark or an urgent benchmark, and we had to make cuts, the first programs that went were those that did not reflect themselves in the benchmarks.
Dodd?
My question actually is an extension of that. I was curious about what might be seen as a proliferation of benchmark. You started out with about 100, the next year went to about 200, now you're at 300. Is there a risk of everything being benchmarked so that there's nothing that's not benchmarked and it all sort of seems to be either equal or kind of watered down?
That is a very interesting phenomenon. We did have 158. We then took those to the legislature. The legislature added benchmarks, and then in our second round there were additional suggestions. We're committed this round to actually reduce the total number of benchmarks. And what we find is in any particular subject area, the folks working in that area feel there aren't enough, whether it's children and families or environmental quality. But when you look at the whole totality, when you're talking about something as complex as a state, there are a lot of measures you want to think about. To try to help that, we do have what we call core benchmarks, which are a summary of the vision for Oregon, and we have urgent benchmarks, which communicate the highest priorities for the state, and those are used in budgeting and planning, so it's a way of getting ourselves focused. And that helps deal with the benchmarks proliferation, but it is a challenge, you're right.
How many are there core benchmarks? How many
core benchmarks are 18.
Thank you.
I would tell you there's one other way to get rid of a benchmark, and that's to accomplish what you set out to do. One of our benchmarks was to reduce the workers' compensation rates in our state from the level we were to a given level in the benchmarks, and when we reached that, the benchmark went away. We had accomplished our goal, so that's another way to get rid of them.
It's amazing how fast time goes. Did you have...
May I, please?
Yes, sure.
What have you done in the case of a benchmark which involves vital services or vital programs and the goal is not met?
Well, I would say it's still early in terms of the process. There are lots of goals we have not yet met, and I'm sure that will happen. The whole theory of the system is when you don't meet a goal, then you re-look, you re-engineer, you retool, and you keep working until you make progress. And that's the whole, by design. We're not going to achieve every benchmark. The idea is when you don't,